Welcome to the Support for Caregiver Awareness, Learning, and Empowerment 8-week webinar series that aims to empower you with practical information and skills by enhancing your self-awareness and focusing on your own needs to improve your mental health and well-being as a caregiver. I am Stacy Chung, and I'm assisting with the moderation of the webinar today. Today marks the 4th week of the Scale 8-week webinar series. Today's webinar topic is called How Caregivers Can Manage Anxiety and Anger, which explores where feelings of anxiety and anger come from and how to manage them in the context of your caregiving role. So I'm pleased to introduce today's speaker, Michal Goldstein. Michal Goldstein is a registered social worker working at Dynamic Health Clinic in Toronto, where she sees adults for individual, couples, and group counseling. She is also the founder of Creating Connections, a play-based therapy practice in Toronto, where she works with children suffering from mental health and behavioral challenges. She has over a decade of experience working with caregivers to support them in improving their ability to cope with the challenges inherent in caring for a loved one. Michal has developed numerous workshops and support group programs utilizing knowledge of interpersonal neurobiology and mindfulness techniques to support individuals suffering from physical health and mental health and parenting challenges. She is passionate about bringing evidence-based practice to the forefront of the clinical social work field. Michal knows both firsthand and from professional experience the challenges that come with caring for a loved one with a physical and mental illness, and is grateful for the opportunity to bring more awareness, education, and support to this community. Thank you for joining us today. I'm going to turn it over to Michal.
Hi, everyone. Thank you, and welcome to today's webinar. So in today's webinar, we are talking about how we can manage as caregivers our anxiety and anger, which is two very common emotions that come up for caregivers, and which is why we wanted to address those very openly today. Part of the SCALE program, which we review every week, is this webinar that we have, and then as well online group coaching sessions, Mondays 12 to 1 and Wednesdays 6 to 7, which are great ways of getting support around these emotions and all the other experiences that you have as caregivers. We also have one-to-one phone counseling, Mondays 9:30 to 11:30, Wednesdays 9:30 to 3:30, and Thursdays 6 to 8, both with myself and another practitioner from the clinic. The French program also has an online group coaching session on Thursdays from 7 to 8 and one-to-one phone counseling. So we've gone through a number of webinars already, and we're now on week 4 of the series, where we will begin to talk about managing anxiety and anger. And this is going to be something that we're going to further develop in the coming weeks, how to manage both the sadness and guilt that we spoke about last week and anxiety and anger that we'll speak about this week. For any of the webinars that you might have missed from the previous weeks, they are available on the OCO's Vimeo site, and you can review them there and even review the ones that you have seen. It's always helpful to hear the information again. So we're going to start our discussion about anxiety and anger, just giving a real, life example of a caregiver named Jim, who is a caregiver to his 6-year-old autistic son. He's more of the primary caregiver because his wife works full-time, and a situation that now Jim has come across, instigating this angry expression you see on the screen, is that his son has become more and more aggressive at school with the other kids, and the school has now contacted Jim and informed him that he can no longer send his son to school. They say that his behavior is uncontrollable and that they just can't keep him there anymore. Jim, who, as you can imagine, was already maxed out emotionally and physically because of all the tasks that he needs to complete as a caregiver, feels very angry about this decision. He feels that it's not fair. He feels that they're not providing their son an opportunity, and they're not providing him outside therapy to control his behavior. what happened as a result of that is that when the school contacted him to share their concerns and to share the decision that they've made, he lashed out at the school. He raised his voice. He told them that his son is normal and that they shouldn't be teaching children with special needs if they can't handle it, and really let out his aggression on the school. Jim finds now that, during this time period, that he's become very irritable lately. He often will raise his voice with his son. He feels tense and that his heart rate is up, and he's gone to the doctor. His blood pressure is even elevated. He just, given all of that, he can't even imagine how he's going to have his son home now full time if he is not able to find another school. And he's just feeling so utterly overwhelmed. And tonight he even, he got upset at his son and ended up yelling at him. And then he got into an argument later in the week with his wife as well. So we want to look at what is anger, right? What's happening inside of us? What's happening inside of Jim when he experiences anger? Anger is one of the most basic human emotions. It's as elemental as happiness and sadness, anxiety, disgust, frustration. These emotions are tied to our basic survival mode, which we spoke about in week 2 of the webinars, in terms of how stress affects our body. We spoke about this fight or flight or freeze response that our sympathetic nervous system activates when we're in a situation that is, we're needing to go into survival mode which often happens as caregivers. It's a situation where you feel threatened or endangered. And fighting this fight mode, and what happens with anger, it doesn't mean you're, necessarily physically fighting with somebody, throwing punches. It means that we're motivated in that moment to combat some sort of injustice that we feel has been done to ourselves or to somebody else, or in situation. However, anger, as you know, when it's used too easily or too frequently, can really undermine our relationships and can undermine our true goals, our true intentions within our lives and within our families. It also, because it's releasing these stress hormones that we spoke about when you're in fight or flight mode, when you're in this survival mode, because of that, it can actually have a negative impact on your body and your physical health. So what we want to look at with anger is what's happening underneath the surface. Anger is known as a secondary emotion. So there is a feeling that is happening prior to anger that is actually the primary emotion behind the drive for anger. And that's what we want to take a look at. Some of the primary emotions that might be behind anger are fear or sadness or pain, right? So a secondary emotion is one that's fueled by other emotions. So what that means is that when a person is angry, something is causing that anger, right? Let's say someone is angry because they are hurt in some way. So that emotional pain that they're feeling is actually what's driving the anger. It's not just the situation at hand or what's in front of them. It's the hurt or the frustration or the anxiety or the worry, the fears that are the driving force behind the anger, right? When a person feels hurt or worried, they feel vulnerable, right? They don't want to kind of live in that emotion. And so they automatically activate this need to protect themselves. How do I protect myself from this emotion? I lash out, I get angry. You might also feel, if you're frustrated or you feel under attack, right? That also creates feelings of vulnerability. And so we mask this feeling of sadness or grief or hurt with anger because it's a lot easier, so to speak, to live in. So thinking about Jim and his experience, what primary emotion do you feel might be driving his current anger at the school, his explosions at his son or his arguments with his wife? Perhaps it's a sense of fear of, how am I going to manage the situation? I'm already so overwhelmed. How am I going to manage now? Right? And this feeling of incompetence or inability to manage the situation at hand, right? So addressing anger means really addressing some of the primary emotions that are going on for you that are feeding the anger that you're experiencing. And one of these being the other topic of today, which is anxiety. So let's take a look for a minute at that emotion. So meet Cindy. She's a full-time caregiver to her husband with dementia. If you remember from last week, she also was coping with caring for her mother. Her husband now has developed some signs of dementia. And as it's progressing, she's constantly finding herself worried about leaving him at home. She's worried that he, could turn on the stove and burn himself. She's worried that he might walk out of the house, that she might forget to lock the door and he'll just walk out. She's actually herself stopped going out places because of these fears. And now she's just staying home all the time just to watch him. At times, different family members will try to encourage her, go out, leave Stan with a caregiver, a paid caregiver, but she is finding herself way too preoccupied with the worries and the anxieties that she's worried that this person might not, kind of think of all the things or, know all the things to look out for. And what if she forgets to tell him and the paid caregiver? And so she just is starting to refuse to go out altogether. She's just constantly kind of assuming that something bad is going to happen. She's finding herself constantly going to that place of assuming that the worst, that something bad is just going to happen. And she's also finding a physical sensation associated with it. She's really physically bothered whenever Stan's even not in the room with her, right? So it's not just about her going out at this point. She's finding herself short of breath and has a dry mouth, and she's shaky. She's starting to feel nauseous, just always on edge when he's not around or in sight. So when we look at anxiety and we think about her situation, we think about what is the fear that's provoking this, right? We can't deny that there's definite fear that's provoking some of these emotions, right? And that's the case with all anxiety. There is some root, natural, realistic fear that is typically the core of something that then progresses into anxiety, right? And the question is, what can she do about this intense worry and fear, right? Fear is one of those primary emotions that we just spoke about, which is important, and it's adaptive when it protects us from harm. It's an emotion that instigates this fight or flight mode that initiates this process, and it's adaptive. We need that. We need that in order to protect ourselves from danger, right? So on a biological level, it's heightening her awareness to certain things. It's getting her adrenaline going to be able to kind of notice and be aware of everything that's going on. So it really does serve a purpose. It makes her senses more acute. It makes her able to see and hear better. For anyone that was on the second webinar, these are some of the things that are activated in our biological system when our fight or flight mode gets activated, right? So it's adaptive in the sense that it's useful for us to be able to protect ourselves from certain things or protect others, in this case of being a caregiver. But we want to look at with fear and anxiety is reaching a place of well-being, of being able to recognize when something can or can't be protected against. So anxiety can be there to inform us of a situation, but it can't be there, or we can't allow it to be there for us in a place where it then controls our decisions. So when we look at living with anxieties or living with an anxiety-provoking situation, we want to look at managing our anxiety and understanding that it's a natural response to a worrisome situation, but that often it can cause us to worry about things that are not necessary to harp on, right? So it's about being able to let go of control over the things that we really should be letting go of and notice the difference. So when we look at our story, can we notice the difference between things that caused her to worry necessarily, and things that then progressed, where the anxiety progressed and the stress response progressed to a place where it was becoming unhealthy for her and it was allowing her fears to run the show, right? So we can't worry about and control everything, but we can manage our anxiety in a way that we can recognize the areas of our life that we have control over, and we can make changes and we can make adaptations, and the ones that we don't, and where it's actually damaging to us, to try to kind of manage all the situations or expectations in our life. So, for example, in our case, the worry that her husband may leave the house or turn on the flame, that's adaptive, right? That's protective. She's worried about something, and it's initiating a process of ensuring certain things that might actually be a danger to her husband, but not allowing herself to leave the house and allowing someone else to help with the care. It becomes maladaptive because it's an area that's causing her too much anxiety, which means that it's causing her unhealth, right? So here she is protecting her husband, but bringing about for herself unhealth, right? And that would be maladaptive. So we'll talk more about this and get a better understanding of kind of how to maneuver the differences between the two, because I think it's very nuanced. So in summary, anxiety and anger are there to inform us of something. There are body's natural self-protective mechanisms, right? They put us on alert to recognize when there is a danger, so to speak, when there is something where we need to activate this fight or flight response to. But our nervous system doesn't know the difference between a real physical threat and an imagined threat. And so our fight or flight reaction might be triggered at the wrong time for the wrong reason, right? The goal is to protect us from danger, but for those with increased anger or anxiety, the symptoms can actually become an obstacle for optimal functioning, right? She would be a much better caregiver if she was able to also take care of her needs. You know, if she's not sleeping now because she's worried about what's going to happen at night, then that's an obstacle to her optimal functioning. So for those of you who were on last week, you'll remember that we spoke about these pesky little ants, right? These cognitive distortions, these automatic negative thoughts that infiltrate our minds and impact our functioning. So just as last week, we looked at ways in which some automatic negative thoughts around guilt or sadness come into play, the same exists for anxiety and anger, right? There are ants that lead, automatic negative thoughts that lead the show, causing these cognitive distortions that cause us to unhealthy and unhelpful anxiety and anger. So one of those, and you might hear, you know, as we go forward in a few examples, some of your own words in these statements, or it might bring to mind another situation or another thought that you find kind of coming into your mind a lot that really does lead to, you know, unhelpful behavior, whether it's with anxiety or anger or with other emotions. And so I encourage you to, you know, if you have a paper in front of you, to write down for yourself if any of these statements sound familiar to you, or if they bring up for you any other areas of negative thinking that you might notice. So the first area that's common with anxiety and anger is blaming. So blaming can look like it's, you know, it's her fault that mom got sick. It's my fault that the right treatment wasn't gotten. It's my fault that there aren't the right services at play right now. The facility doesn't know what they're doing. They're making mistakes, right? Also, I'm so ignorant for forgetting to take her. I can't believe I forgot that she's allergic to, this food, or that she's sensitive to this fabric. Any sort of blame where you're looking at either yourself or somebody else and looking at, mistakes that were made here and feeling like that's not okay. And that blame then brings us to a place, that automatic negative thought, which is rooted in blame, right? So that's what you want to look at. Do I have these automatic negative thoughts that are rooted in a sense of blaming myself or somebody else? And that's a sign for you that an ant is at play. Another example would be looking at a situation as a catastrophe and thinking, if she continues to get sick like this, she's going to pass away, right? Worst case scenario type of thinking. The medical bill was so expensive, I'm going to go bankrupt. This virus is going to kill all of us, right? This worst case scenario thinking. It's never going to work what I'm trying. I'm never going to be able to do this well, right? Thinking of the catastrophe in a situation. So think for yourself, are there times where I'm finding myself really thinking of the worst case scenario and actually living in that worst case scenario, right? So when Jim was worried about what would be when his son comes home, he's not thinking of, a little issue around his therapy. He might be thinking of, the worst possible behaviors that he has seen in his son and, exacerbated to the 10th degree. And that intense emotion is what then will cause him to express either anger or internally anxiety about a situation. Another example is this all or nothing, right? So my siblings do absolutely nothing to help out. Nothing I do helps, nothing I do works, nothing I do is good enough. Things will always be this bad. I'll never learn how to manage this. I'll never be able to respond calmly, right? This all or nothing mentality. Another example would be, a big challenge for many caregivers is medication refusal. And, so you might think, well, if she doesn't get on this medication, then I cannot handle this, right? So that's an all or nothing. I'm never going to be able to handle this. There are, these are normal thoughts that we might have in our situation, but what's important to recognize is that they're hurtful to you. And even more so, they're hurtful to your ability to cope with the situation and to be the best that you can be within the situation you're in, right? And so what we really want to do is come up with a more balanced way of looking at things, right? So yes, it might be true that if she doesn't get on the medication, it will be very difficult to handle. But the all or nothing is saying, I can't handle this, right? So that's what we want to differentiate. We want to kind of notice what these automatic thoughts we're having and work on turning them down a notch, so to speak. So take our example from before, take Cindy's example. She doesn't feel comfortable with an aide taking over, right? She worries about leaving the house and worries about what that will look like for her husband, or whether the right best care will be provided in those situations. And that makes sense, right? You may worry about leaving your loved one. You may worry about taking time for yourself. You may worry about the outcome of what will occur if, this isn't done a specific way that your loved one is used to, or that might be ideal or best for them, right? And it invokes this fear. What will happen, right? An overwhelm of how can I manage to get the groceries? How can I manage to sleep? How can I manage to take care of myself? And then you set into exhaustion, right? Because you're not taking care of yourself properly. And so what we want to look at is, what is this core driving force for her, right? What is the core feeling that is causing her? What is this automatic negative thought that is causing her to not do the things that are necessary for her? I would say one thing that might be driving her is an extreme place of sadness, right? Because the true cause of the fear is that she's not wanting to lose her husband, and she's so terrified of what will happen to him, sorry, right? If and to her if she loses him, right? So, recognizing these ants, recognizing these automatic negative thoughts, this catastrophizing and this all or nothing, they cause us to be able to take a better look at what is actually the root cause of our emotions and what is it that we're afraid of. So one thing we spoke about as well last week is running through a CBT thought record in order to kind of get more to the root of what's going on for us, right? So in our situation that we were describing before, so what's the situation? She's afraid to leave the house. She doesn't want to leave the house. She's worried about what will happen, and she won't leave as a result. So what are some of the feelings that it evokes? It evoked, as we said, a feeling of worry over her husband, a feeling of overwhelm over not taking care of yourself, and a feeling of fear of what will happen, not just in this situation, but what will happen if something happens to her husband. And as well, sadness over the thought of something happening to her husband. So then you want to write out what are some, and I believe this CBT thought record, a sample was sent out last week that you can use to sort of break down some of these thoughts. So what would be an automatic negative thought that she might be having in that moment? Could be, if I leave, then something will happen to my husband, right? This will happen. She's thinking of the worst case scenario here, right? Something will happen. Something can go wrong. Someone can get hurt. Now, so this might be true. There is a true worry there, but we want to consider, is there any evidence to support that it might not be not the case, because it is the case that there is something to worry about. But let's think of whether or not there's evidence to support the fact that it might not be as extreme as we're making it out to be. So again, it's toning it down that notch, right? So what would be some evidence is that, and many people have aides that help to take care of a loved one. And there are very competent aides that can take care of, that are paid caregivers that can support you in taking care of your loved one. And yes, it might not be the care that you can provide, which, because your loved one will be the best care, but it allows other things to be, and there's other important pieces at play here, right? So the evidence to go against the negative thought is that there are many people who are cared for by aides very successfully, and that there are certain things that she can do to prepare herself. And that's a more accurate depiction of the worry, right? So now we want to write a new or more balanced thought that's more accurate, that's based on the evidence. So that would be something like, while I'm very worried about the fact that leaving my husband might mean that he's not going to get the best care, I know that with proper, direction, the aide or paid caregiver can provide support while I'm away, which is also important. And now you want to relist, because this helps to kind of motivate this change that you want to make internally, and look at, now that I'm thinking about this with the new or more balanced thought, are there, is there any decrease in the intensity of my strong emotion, my strong anxiety or anger with relation to this situation? So this is one technique that you can use that we also gave last week. Another thing we talked about last week was recognizing, what is the need that is the driving force behind a decision that we make, right? Take the example that we had of Jim. His need is to ensure that his son is getting a proper education and good supports, right? His need is to have a break, right? So there's a strong need for rest, for security with his son's development, that is a driving force for what is happening in the moment where he's losing his temper and yelling at the school. So you want to look at, okay, let's observe the situation. The school has just called. They can't have my son. What am I feeling right now? I am feeling utterly overwhelmed and worried about what that will mean for what things look like at home, right? And what is the need there? The need is that I need a break. I know that I can't manage all of this on my own, right? And then you want to look at, well, so now what do we want to look at moving forward? And the requests piece is, what concrete action do I want to take here to ensure that some aspects of my need can be met? So what that does is it allows you the ability within a situation, right? When this is practiced outside of situations, within a situation, to be able to express in a non-aggressive way, or in a less anxious way, what your needs are and what is it that you can provide. And that can be a conversation that happens either internally, if you want to say to yourself, you know what, I need some time to just process all of this. And so I'm going to ask my mother to watch my son for the day. Or I'm going to ask the school, okay, I understand that, please give me to the end of the week. Or, I know that it means that I'm going to have to engage in some additional self-care this week, right? This is recognizing the need allows us to make requests and go forward in a different way. And it also allows us to be able to practice assertive communication in situations where we are feeling really anxious or angry, right? So it's this, it's a middle road. We don't want to, take the situation of Jim, take a situation where you're, trying to communicate with a healthcare professional around an issue. And that's a very common challenge for many caregivers, either to communicate to their loved one, to communicate to the healthcare team, to communicate maybe to another caregiver, like a sibling who might be helping out with your care, or another parent if you're caring for a child, right? So being able to communicate to them your need without a place of, allowing that anger and anxiety to take over and it to become a very aggressive conversation, right? We want to find a middle road between aggressive communication and then, passively just allowing someone to take advantage of us in a situation, right? So there's very often things that we can do and ways that we can communicate our needs that doesn't become aggressive, but also isn't allowing us to sort of take the back burner and just not, do anything in a situation that's very challenging for us. And just like with any, healthy communication, using I statements is one of those techniques that you can do to sort of, it's not just to convey the message, but it's to calm yourself down and to recognize what your need is here. I'm having a really hard time with the fact that, I've been calling to ask for information about my mother and I'm not receiving that information, right? In the case of Jim, I know he's been hitting the other kids and that concerns you, but he also, he's able to, with this I statement, calm himself and convey to the school that actually his son just started a new medication, for example, and his mood will actually be changing in the next few weeks. And so, I'm asking that you be a bit more patient and maybe there are other things we can implement, right? So bringing ourselves to a place of recognizing, okay, what is happening here in, slowing down that process with looking at our needs also can help us utilize the communication tools that we might already have and convey what we want to, whoever we're trying to interact with at that moment. So I just want to go through a number of different strategies that we can use. And some of these we'll talk more at length in the coming webinars. And these are just all, different ways that we can approach our feelings of anxiety and anger in order to, like we said, manage them. Because they're there, they exist, these emotions exist. And so it's not about eliminating fears and worries or eliminating things that make us upset because we might not be able to in our situation, but rather it's about strategies to cope with the experience so that we can, act the way we want to in our life and continue and proceed the way we want to in our life. So relaxation techniques such as deep breathing, meditation, mindfulness, these are all areas that we're going to touch much more in depth about actually next week in the webinar on becoming a mindful caregiver. But just taking the time as simple as, taking a deep breath in a situation where things are really overwhelming, and even just that pause can allow us to move forward in a different way. And that brings us to the next strategy, which is rest. And that what that stands for is R is for relax, E is for evaluate, S is for set an intention, and T is for take action. So relax implies exactly what it means. Take that deep breath, get yourself to a place of more clear centeredness, a place of calm and inner peace. And it doesn't need to be perfect. You're not going to feel perfect in that situation, especially if we're right then and there. But it's really about taking that pause. It's about stopping for that minute and bringing yourself a bit more back to where you want to be. Then you want to evaluate. E is for evaluate. What's happening here? What's happening within the situation? And what's happening within myself? What are some of the emotions that are happening inside right now, right? The school is telling me they can't take my son. I'm feeling really anxious and overwhelmed. Okay, so pause, evaluate what's happening. And then S is for set an intention. The intention is about what are the true desires and wants that I have in this situation. Jim wants his son to stay in school. You may want to establish a loving and caring relationship with your loved one. What do I want here? What's my intention? If you think about a situation where, you're really upset and angry about something that your loved one is saying to you in that moment, and you're finding yourself getting really angry, and from all the caregivers I spoke to, I know so well how much they don't want to and feel so badly about the times that they do lose their temper and that they do react in a way that's not their best self, right? So what's my intention here? What is it that I want in this relationship? I want a close and loving relationship. So setting that intention in that moment. So you're relaxing, taking a deep breath, you're evaluating, okay, here's the situation. My mother is criticizing the way that I've just prepared her food. It's making me really upset because I worked really hard and I'm absolutely exhausted. Set my intention. What is it that I want to be doing here? I want to be caring for my mother in a loving and caring way. And now T, we want to take action. We want to choose a course of action that is what we want to proceed with. So it might be, I'm going to walk out of the room for a minute because I need some time to relax. And then I'm going to come back, paste a smile on my face and say, okay, here's your supper, right? So that might be a course of action. And it doesn't mean always proceeding with perfection. It could mean just putting the food in front of them if they're able to eat on their own and just walking out of the room. And that might be your course of action, right? But the idea is that we're doing that intentionally. And we're doing that with a pause and an evaluation of what we're experiencing in that moment. Another strategy, and this is something that I often use with clients that are really challenged with anxiety, is a way of breaking down their worries, right? So if you look at this, I'm very anxious about, my mother entering a long-term care home and what's going to happen with that. I'm worried about the fact that I need to go back to work and I don't know how I'm going to manage all of these things. So what happens with anxiety is that there's a lot of different parts to it. It's not just one big thing, right? But what we need to do is break down what are all the different worries. And I've sort of demonstrated here, like sectioning off what are the different worries. And some worries might kind of take up, 1, 2, or 3 sections of this line. And some worries might be much smaller and take out half or one section of the line, right? So you could have one worry that's from 0 to 3 in terms of size and how impactful it is on your worry, and one worry that's from 3 to 4, right? And so goes across the line. And so what you want to do in those moments of anxiety is to start breaking down what this anxiety is actually about, right? So if I'm worried about, my child starting a new intervention program, or I'm worried about, me having to go back to work, what are the sections? What are the parts of that worry? First, how am I going to manage the morning routine? Second, what is going to happen when I'm being called upon at work, and because there's something happening with my loved one's care that I need to address? How am I going to deal with that? And how am I going to make sure that supper's ready because I'm not going to come, right? So there's all these different parts to the worry that create this overwhelming emotion of anxiety, right? And so we want to break it down and look at all the different parts. And then the next step to that is to look at what are areas that I can address within any which one of these worries. So just to kind of simplify it for the purpose of explanation, let's say the piece of that worry that might involve how am I going to prepare supper if I'm out at work, because I know that right when I come home, there are certain caregiving things that I need to complete, right? And so I won't be able to have time to make supper. So it could be arranging meals sent to your home. It could be putting up food in a crock pot the night before. It could be, ordering in on certain days that those caregiving tasks are needing to be complete, or looking towards supports for yourself that might not be able to provide the caregiving role, but might be able to provide you with help around the cooking, right? So you're taking all of these areas, you're breaking down the worry into different sections, and you're then taking each one of those sections and looking at, is there anything that I can do in this one area that could provide some relief, right? It doesn't have to be major. It doesn't have to eliminate the issue altogether, but perhaps it can provide some sort of relief. And what happens then is that we're able to shrink some of these worries. And anxieties are so if you can, what I was saying is that if you can address even just 1 or 2 of the challenges, then you can begin to shrink that worry and make it something that's a lot more manageable. One of the other tools that you can use is rehearsing. And that refers back to, this rest example that we gave of relax, evaluate, set an intention, and take action. And it's about looking and being prepared for what might come. So thinking about scenarios that might happen, and sort of preparing yourself for what's the intention and the action that I want to take in those situations. And I think that, most of us know kind of some of the common areas where we find ourselves feeling very anxious and angry. And so we can sort of prepare ourselves by addressing some of that ahead of time and looking at this rest technique and implementing strategies for ourselves even before the situation comes to be an issue. One important other strategy is forgiveness. And this is about, not just forgiving yourself and but forgiving other people as well. And this is something that we'll talk about with relation to self-compassion in the coming webinar. But just the point that I want to touch out today is that, forgiving somebody's actions that cause us anger, or forgiving a situation that we feel like we've made a mistake and that's causing us anxiety, it's not about eliminating the problem. It's about relieving ourselves of the burden or the anger or the worry that we feel with relation to the situation, right? So when we talk about situations that cause us a lot of anger, we look at, how come my siblings aren't helping out more? Or perhaps if you're taking care of a parent and, there's there's a history there, right? There's a whole relationship that existed before you became their caregiver. And so, having challenges with working on forgiveness to them about some things that have happened in the past, right? So, that is something that comes up a lot in terms of the core emotions under anger and anxiety for people. And what we want to look at is forgiving the person for what they have done, or forgiving their inability to do what we wanted them to do. It's not about them. It's about us being able to manage our emotions and our situation in a better way, and manage our ability to fill the shoes that we have to fill in a way that we can have more inner peace. One of the techniques that I like to use is writing a forgiveness letter. So really being able to just let it all out on paper, the impact of their decisions on your life, whether it's current or past, and how much it's impacted you and how much it's hurt you. And, just being able to let it all out, and not with the purpose of sending that letter or giving them that letter, but for the purpose of really being able to get to the core hurt and pain that's under that, that anger. Because like we spoke about before, the secondary emotion of anger has a really painful, deep core to it. And so we want to look at that piece, because alleviating some of that is going to alleviate some of the anger that we're experiencing. And engaging in compassionate behavior, again, will focus a lot more on in the week that we talk about self-compassion, but it's really just about looking both to yourself and to others with a compassionate eye, both in the mistakes that you might have made and in the mistakes that they may have made. And lastly, much of anxiety and anger comes from overwhelm. And it might be very challenging at times, but asking for help from people around you, your supports, and even when those supports are so minimal, but when you're finding yourself becoming taken over by anger and anxiety, if you don't have other supports, then it's important to look for supports for yourself through individual or group counseling, from the other amazing programs that the OCO has to offer, and asking for help, because overwhelm is, one of the biggest triggers for anxiety and anger to come into play. You can look at a situation that you deal with every single day, but on some days you end up exploding, and on some days you don't. On some days you end up feeling really anxious, and on some days you don't. And that's about that overwhelm piece. There's so many different components that come into play, right? When we looked at that scale of 0 to 10, when one more piece gets added to the anxiety or the frustration, then all of a sudden it becomes too overwhelming. And so really noticing that and asking for help when you need it, even when it seems, those resources you have are so minimal, then again, getting that help for yourself is so crucial in being able to manage anxiety and anger. So these are just some suggested resources that address, some of these issues of managing anxiety and anger that you can look further into.
Thanks so much, Michal, for the talk.